Welcome to the Rural Journey Speaker Series. My name is Kester Nucum, and I'm currently the president of the Rural Reimagined Club here at Tennessee Tech. We are very excited to be here today with Daniel Hines and Libby Baldwin Duke to talk about their amazing rural journeys as the co-founders of the BrantleyMarie Medical Devices and the winners, and they are also the winners of the 2020 EagleWorks competition. So for those of you that are unfamiliar with Rural Reimagined, Rural Reimagined is Tennessee Tech's Grand Challenge initiative to unite students, faculty, and community members to support and transform rural communities through research, civic engagement, service learning, and entrepreneurship. And this was established in March of 2019 in accordance with Governor Lee's vision to help out rural communities in the state of Tennessee. So the Rural Reimagined Club is the premier student organization under the Grand Challenge to bring all disciplines together to build awareness and advocacy for rural communities. The club has served as a platform to learn about rural issues that face our rural communities and share also opportunities to serve rural areas that involve their career and personal interests. So the Rural Journey Speaker Series, which we are doing right now, was created in the fall of 2020 to discuss cross-disciplinary issues in rural Tennessee. And in the past, we've had media personalities, K-12 educators, student leaders, and for them to share their stories about how they became advocates for their local rural areas. And today we are very excited to have two of Tech's premier student leaders with us today. And if you haven't seen it, they were also even featured in the Tennessean for their amazing work as well. So today we have Daniel Hines, who's currently a senior here at Tech, and Libby Duke, who just graduated last August. And I guess rather than me introducing them, I guess I'll ask them to introduce themselves and just start off with what's your rural journeys? So whoever wants to start can go right ahead.
Yeah, I'll go ahead. Can everybody hear me?
Yes.
Good. So I'm from Mount Juliet, Tennessee. And when I guess referring to my rural journey, Mount Juliet's not too rural, just being, 25 minutes outside of downtown Nashville. So my real rural journey began when I came to Cookeville, if you call that rural, and working in various aspects such as the remote area medical clinics that we would host on campus. And I also work at a hospital just in Hermitage, Tennessee. And that hospital is kind of the first hospital that you get to when coming into Nashville from Cookeville area. So we see a lot of patients from rural areas in Jackson County, Smith County, Charlesdale County, and DeKalb County that are transported to our emergency department via ambulance or from other methods or from other smaller facilities. And so, I was kind of exposed to, rural healthcare starting off, when I was a freshman here working, like I said, in the RAM clinics, and then working in the emergency department, seeing a need for an improvement in rural healthcare. And so, going back to, my future, so, I'm applying to medical school this summer. And, I knew I wanted to be a physician since I was in high school. But since coming to Cookeville, I really felt a need to serve the rural areas of Tennessee. Since I've become more exposed to the disparities that people have when they don't live within 30 minutes of, a major hospital or a trauma facility.
Libby?
Yeah, I guess I'll jump in next. First of all, I'm going to apologize. I woke up a bit under the weather today, so I have my tea and honey, and I'm going to speak as much as possible, so I apologize for my voice. As Kester said, my name is Libby Duke. I graduated in August of 2020 from Tennessee Tech with a degree in biology, concentration in health sciences. I then applied to PA school and was accepted to Lipscomb University's PA program. So I'm very, very excited to start that in August of 21, so of this year. I'm a bit different than Daniel in the terms of my rural journey. I am from a very small town called Charlotte, Tennessee. It is a little city in the county of Dixon. So I'm about 45, 50 minutes from Nashville, which would be the next major hospital. We have a smaller hospital in Dixon County But most patients, if they need to go to the trauma center or a children's hospital, they would have to be transported to Nashville. So I got to see firsthand the actual need for healthcare in rural areas. Oftentimes, it would take anywhere from 15 to about 30 minutes for an ambulance to get to some areas of my city. And so then once an ambulance got there, if that patient needed to go to a trauma center or a stroke center or anything like that, they would then have to make the 45-minute ambulance ride to Nashville. So as you can imagine, for a patient that is in a life-threatening situation, those aren't really great odds. So I knew from a young age that I wanted to practice medicine and serve my community, come back to serve my community. So the best way for me to do that was to become a PA. So hopefully that's what I'll do. When I got to Tech, that was actually the big city for me. I thought I was in a rather large area. Like I said, my little town has one red light. So I was not used to all the people, but I was very excited to go to a larger school. And it was at Tech that I met Daniel. We had several classes together our freshman year. Because us biology nerds tend to stick together from the first year and beyond. And so we took several courses together, and that's kind of how we came to our rural journey with innovative healthcare. Neither of us really set out to be inventors, so to say. Our goal was to practice medicine. But through an interdisciplinary course at Tennessee Tech that Dr. Geis taught, we were exposed to the Rural Reimagined initiative, and we were able to go out and find a need in the healthcare field that was unmet, and ours just so happened to line up with rural medicine in terms of intubation. So for anyone that's not familiar, if you are at home or wherever and your airway is blocked, so you're unable to breathe for yourself, you call 911, an ambulance comes. They have to intubate you, meaning that they have to stick a tube down your throat and breathe for you. Oftentimes, this is very difficult if the airway has lots of fluid buildup. Maybe there's trauma to the airway, secretions, things like that. So it's very timely for intubations. And so we were able to design something that kind of helped make this process a bit quicker for those longer ambulance rides all the way into Nashville in areas that were rural, such as myself. So I'm going to let Daniel talk a bit more about that.
Yeah, so the main, going into that, I guess the problem discovery came from, we were seeing patients come into the emergency department that I worked at that either were not intubated because they were unable to secure intubation in the airway. They were improperly intubated, so they were intubated down into their esophagus, which leads to the stomach, rather than into the trachea, which leads to the lungs. Or they were using something called a King's airway, which is kind of like a halfway point between just a bag mask, where it's just a face mask that goes over your face when they're bagging, and then actually intubating. And so, studies have shown that this King's airway isn't as effective as, obviously a proper intubation. In fact, some say it's not effective whatsoever. So we were seeing patients come to our emergency department from these rural areas, even in my own city, that's, you can get back up into Mount Juliet and be 25 minutes away from the hospital, that were improperly or not intubated at all, which led to them being hypoxic and leading to brain damage in the ICU and then never recovering. So after seeing this time and time again, I realized that there was that need for improvement. And that's what led us to our device and our company.
I know that's an awesome story. Thank you both for sharing. And I know that we have some people in the audience right now who are very interested in rural healthcare. And I know, Libby, I'm from Paris, which is just an hour from
You're not too far from me.
Yeah, so I definitely understand the whole coming to Cookeville, and it's like, wow. I still argue with my best friend from Nashville. I'm like, Cookeville's a big city. What are you talking about?
That's how Daniel and I are all the time. I'm like, no, this is large. Like, I'm getting lost.
Yes. And so I guess for something I would like to, for you to expound upon is, how did that class here at Tech just help you on, this journey? So I'm trying to word it right. I know it's a Tuesday and it's a couple weeks after spring break. It's just very busy time. But I know with a lot of students, they don't realize a lot of times there's opportunities that, a lot of times these like classes like Clinical Immersions that Dr. Geist and Dr. Sanders teach at Tech. What would you say? Like, what could you describe your experiences with that class and like what kind of prompted you and your expectations versus what actually came out of it? So
Yeah, I guess I can start. I don't remember if it was Daniel or myself that when we found out about this clinical immersion course, it was emailed out to all of the pre-healthcare students at Tech when we were juniors, I believe. Yes. And so one of us mentioned it to the other and we were like, oh, let's take it together. So we got to the course having no idea what it was on the first day. Honestly, like you said, we had no idea that these types of opportunities were available at Tech, or a lot of state schools due to this new, is it the Rural Initiative, I guess is what it's called?
I don't know if it's necessarily like an official initiative, but I know that Tech has, it's because of the whole push to help rural communities. Tech and Rural Reimagined became a thing.
Yeah, we had no idea that this was available to us. We came here to study science, get in all the clubs that we could, have all the leadership positions that we could to beef up our resume and get out and go to medical school and PA school. We had no real intentions of interdisciplinary courses even. And so when we got to the course and we were with engineering students, so that was our first experience. And so that was great, learning alongside engineering students because they learn very differently than we do. And so it was great to bounce ideas off of each other. And it was great to have Dr. Geist and Dr. Sanders there to kind of guide us through this process. So the course was all about finding an inefficient product or process in the healthcare community and making it better. And so they were great in, leading us down this path or leading us down this path. So it was more about finding problems and then finding a solution rather than just going out and inventing something. So Daniel, do you kind of want to share your experience with it?
Yeah. So a lot of, I know the way that I think, and I think Libby's the same way, is we're very, future minded, getting to professional school, what's the next step? So when we first entered this class, it was very like solution, what solution can we think of? And, we kind of had to step back, and Dr. Geist was good about this. And what we found and how we landed on where we're at today is from thinking about a problem. And that problem was, as I said, that inefficient process of intubation. And so that's what led us to the solution. And, so we fell in love with this problem that, I'd seen time and time again after working in the emergency department. And so I came back and we all kind of worked together and try to think of, we had several different ideas. We pivoted a few times after talking to, different stakeholders and I guess practitioners that intubate on a normal basis. They kind of guided us along as well and kind of led us to where we're at today. And, going into it, and this may lead into other things, but, we took this class with the intention of, it's a class, we take it, we're out, on to the next step. And, after we gave our final presentation, EagleWorks kind of got mentioned to us a time or two. And, we were told, you really need to apply to do this EagleWorks competition. You've got a good product. And, we were like,
which we didn't believe in.
We didn't believe in.
If everyone at Tech would not have pushed us, we honestly were like, we can't invent something. This was just a class to put on the resume and go forward.
Exactly. And so I think we ended up submitting our EagleWorks application like the day it was due, like within a mere like number, like an hour or two before like the deadline. because we were like, I just don't think we can. We've only been working on this for like a few months. Like, this is not something that we think, can get real success with. There's kids that have been working on these for years, some of them. And so we just didn't feel prepared. And, we were really supported, especially with Dr. Geist and some other people in the community that helped guide us along the EagleWorks track, and which ended up leading us to placing first place, which made us eligible for the 3686 competition, which was the statewide student innovation entrepreneurship competition, where we placed second. And that was super cool too, to not just see what innovation and entrepreneurship was going on at our own university, but to see what was going on statewide. There's so many talented students out there, not only in our university, but statewide. And the entrepreneurship community has been such a cool community to be in. Everybody's so supportive and wants everybody to succeed and help each other out. So we've been super fortunate. And it all started with this little class that I think it was Libby that was like, Daniel, you need to take this with me. And I was like, I don't know what she found. But
all because I didn't want to take it alone, honestly.
Yes.
I needed something else to look better on my application. And I was like, Daniel, please take this course with me.
Yes, I know the feeling. I actually, Dr. Blair, who helped us, who was on the call before we started. I'm taking his STEAM studio class for art education majors, and it's one of those things that it's just like, even if it doesn't count towards my degree, I'm learning a lot what it means to be an engineer, just being around people who are more artistically inclined than I am, and it's helped a lot. So definitely, there's a lot of connections with very great importance of just being around people who aren't from your discipline and working with them, and you never know what forms.
The healthcare community, and in healthcare in general, you're working in teams. You've got a physician assistant, nurses, respiratory therapists, radiology. I mean, it's such a diverse group. So having this course kind of really helped us realize too, like, medicine is beyond your own specific profession. You've got to work and know how to work with people of all professions.
Right, for sure. So I guess before I ask about EagleWorks, I do want to, since there are students on the call right now who they have great potential, and I know, Daniel, you also serve as the student trustee on the board of trustees here and have many leadership roles around campus. So you work with a lot of students just around the clock. So what would you say is the importance of finding, that mentor or that, faculty member or even that community member to help you up and going? Because I know for me, I wouldn't be where I am if it weren't for, like people like Dr. Blair and my mentors around campus who, told me I can, be here and even start a speaker series or like what I'm doing today. So could you describe, how that has really impacted you and how students could and what students could do to to get that, mentorship and leadership and guidance?
Yeah, I guess I can start. So it kind of started with my program. So going in, I'm not sure if all programs at Tech have this, but we had the pre-PA program. So I got several emails weekly. Then there were some monthly updates about the program, and I would meet with my advisor, and they would really say, you need to talk to this professor about this or this professor about this. And I was involved in several clubs. And so that's kind of how I became familiar with the campus. The course and Dr. Geist is what really, I guess I could say she was kind of the first mentor that I had at Tech faculty wise. So she's kind of what got the ball rolling, I guess. And then, she introduced me to Michael Akins, and then even community members that are really rooting for you here in Cookeville, the Biz Foundry, Jeff Brown, Kevin Christopher. I know on one of your other talks, you spoke about Kevin. He's been a great help to us. So just finding that one mentor, I would say, that's a faculty member, whether it's, just staff or anyone in your department, can really get you hooked up with people in other departments. And so that's kind of what helped me get connected with everyone, I would say.
Yeah, I definitely agree. It kind of starts with, you plant a seed and it just, blossoms. And Dr. Geist was really kind of like that first one for both of us. I'd heard from friends that were in the nursing program how, just they described her as superwoman, how just great of a professor she was and practitioner. And she really is superwoman. Like when you just read about her, she's just amazing and she's so kind. But she kind of introduced us, like I said, to Michael Akins and to Jeff Brown at the Biz Foundry. And, we were just two biology students that knew nothing about innovation, nothing about business, nothing about entrepreneurship. And, without those key stakeholders, especially, legal, Kevin Christopher and Rockridge Law, we can't speak highly enough about them. They have just been awesome to work with. They kind of help get you into that next level. You can think of an idea all day long, but without some of these key community stakeholders and people that are standing behind you and supporting you, you're not going to make it beyond just a drawing on a napkin.
Oh, yes, and we were very glad to have Bruce Allen speak a month ago, which I know Daniel attended. So it's very interesting to see that connection, how just all the speakers somehow connect with each other.
Yeah, it's really great. And I would piggyback off of what Daniel said and just encourage any student that, maybe took the Clinical Immersions course or took some other course or had an idea that they were really passionate about and that they knew, I think deep down, Daniel and I both knew this is actually a really good solution to this problem. This could help several people in rural areas. I mean, firsthand, I personally know people that didn't survive to the hospital because they were incorrectly intubated. And then there was a very long ambulance ride because we were in such a rural area. And so if I could, maybe just contribute a smidget of a product that could, increase their chances of surviving, why would I not go after that? And so I guess I mentioned that to say, just if you have a product that you're passionate about or anything that you want to learn more about, the resources are there. You just have to take that first step and kind of say, okay, I need help. This is who I'm going to reach out to first, because any faculty member, other students, people that are in clubs that you're in can connect you and get you the resources that you need. They are definitely there. You just have to look for them. And that's something that I didn't know about before coming to Tech. So I'm very thankful for that.
And Tech is such a supportive community filled with amazing people like Dr. Geist, who's actually also on the Grand Challenge Committee. So she is a huge supporter of Rural Reimagined and trying to, I know she's working on a grant. I don't know about the status of it, but a grant to help Hispanic communities who are affected by COVID-19. And I think that's already being implemented. So
of course she is.
Never ceases to amaze me.
Of course she's doing that on top of being a practicing nurse practitioner and a full-time nursing professor. Of course.
Oh, yes, for sure. So I guess I'm going to ask this question from the chat because it kind of ties in with, it kind of is the perfect segue. So what are your next steps for BrantleyMarie Medical Devices? And so since you have produced a product, is it also being used in, urban communities as well as rural communities? Like what, could you tell us the status of just, BrantleyMarie Medical Devices today?
Yeah, sure. So we kind of have a few rough prototypes that we've got floating around that a few good stakeholders have been able to try out and test for us, which has been really cool. And they've provided such valuable feedback to how we can improvise it. And we are currently patent pending. And due to the COVID-related nature of the product, we were able to secure fast track status on our patents. So, usually patents take years to get approval, and we've been able to do it within 2 months almost. And so we should hear back, hopefully for our final decision to find out how many claims that we've been granted here in the next few weeks. And from there, we're looking at licensing deals. We're just taking on, whatever we can just to get this product out to the rural communities as quickly as possible. To answer, I see part of that question, it's not currently being used in rural communities, but once we get this patent approval, work through FDA clearance, the next step is getting it on ambulances across the nation.
And to piggyback off of that, I know in the chat someone had asked about if it could also be used in an urban setting. It can in high-level trauma centers, whether you're familiar with medicine or not. Obviously, there's a lot more personnel there, so portable X-ray is able to see if you've secured the airway properly. You just have more time and more resources in larger trauma centers, EDs, things like that. Through doing these trials and getting our prototype in the hands of a few people, we've actually learned that this could also very positively affect combat medicine. And so through the rural route, wow, that's a lot of R's. We have been able to see, different avenues that our products could go towards to help save lives. So it's definitely helped us.
Definitely. So I guess what kind of have you things that you wish someone had told you before you started? Because I know innovation and entrepreneurship, starting your own company, can be a very long and hard and difficult process with its ups and downs and challenges. So what are some things that you didn't realize before you came in? And now, like some of the biggest lessons that you've learned coming into now in your next stages of the company.
Where do we begin? I know there's quite a few things. I'll start. Nothing moves without money, unfortunately. And without winning EagleWorks and securing $10,000 that way and getting second place in the 3686 competition and getting another $10,000. And then also using the National Science Foundation grant that we were granted, using CARES Act funding, through the Small Business Development Center here in Cookeville. We would not be where we're at right now. Thankfully, Libby and I, at this point, I don't think I've spent a dime out of our own pockets. Which has been nice. In fact, we've been able to even gain a little bit more just from some of our winnings. But without that, we would, even with just our two EagleWorks and 3686 competition winnings, we probably would have made it about 6 months into the end of the year. But you've got to find and secure that funding, no matter what it takes. So whether that's competing in more entrepreneurship competitions, or taking on investors or looking at grant funding, there is money out there. So don't stress, because there is ways to get to that next step. You just got to work for it and you got to find it. But that's definitely
absolutely. I would say the money piece for me as well. Something that I think that we both have learned is, when we first kind of started, we started doing EagleWorks, and then we won EagleWorks, and we were like, okay, so what do we do now? And so we were kind of guided through that process with Jeff Brown at the Biz Foundry. We didn't truly believe in our product, that it was a commodity. So you have to believe in your idea as a commodity. And I say that to say, protect yourself. I guess we didn't really realize, having that patent pending is very important. Signing NDAs with people, very important. Don't speak to anyone about your product, because oftentimes we as inventors, especially if we didn't set out to invent anything, we kind of just want to talk about it a little bit to people, maybe your aunt or your uncle, or when people approach you about or when people approach you about your product, you're modest about it. And so you just kind of say a few things and don't really want to say, hey, you have to sign this NDA to talk to me about it. I'm so sorry. The legality of things. And so that's something that we both have learned is, while there are so many people on your side, not everyone is on your side. So it's kind of a negative to this positive conversation, but I feel like it's important to note and to tell anyone that is going through this entrepreneurship journey right now, that believe in your product and believe that it's worth being protected, I would say.
Absolutely. That is something that we didn't know at the beginning. And so and nobody really even explicitly told us, be careful what you say. This is a novel idea, protect yourself, because if you don't, somebody else will take it out from under you. So to anybody out there that is got that idea and got that, that next, great thing, have people in your corner that you can help, or that can help you and support you. For us, that was Dr. Geis and Jeff Brown and Michael Akins, Kevin Christopher, all these great people that helped us from the start. And, they helped us secure the patent, get the NDAs drafted up so we could start sending those out to people, so we could talk to potential investors and talk to potential licensors. So definitely, be careful about who you talk to. You've got to find your corner and protect yourself.
Oh, yes. So how would you say that, so you mentioned that neither of you were set out to, be inventors originally, how has this kind of like played out in the sense that y'all, came in as, going off to medical school, but you both ended up as inventors and innovators. What are, your thoughts, feelings, like how did, reflecting back, how has this, happened, or what are your thoughts on it?
Yeah, I would say that we when you come in to study medicine, you obviously know that it's a team sport. That everyone says it's a team sport, it's a team sport. And you think about medicine and healing the patient, but that's kind of all you think about. And so I think for Daniel and myself, the biggest takeaway we've gained from this is the business aspect of medicine. And so we think of ourselves as an inventor or an entrepreneur, I guess, but as a medical student or someone studying to practice medicine, you're always learning. You have to, continuing education hours, you're always researching different products or treatments or things like that. So that part doesn't really surprise me. I mean, obviously it surprises me that we are considered inventors, because I still don't think that we are. But I would say we were able to gain full circle of medicine, and that has really made me appreciate every aspect a bit more. I used to not understand why does medical care cost so much, or why is this not available to everyone? Why didn't you just intubate them correctly? And so I think for me, it's kind of helped me see, like I said, full circle of medicine and in a completely different way.
Absolutely. I mean, I agree. I mean, that's really all I have to say with
that. Oh, definitely. So I'm gonna, so for anyone in the chat, if you have any more questions, I'm gonna ask this one question in the chat, but if any of y'all watching has any questions, please feel to drop them below and we'll get them asked. So another question I have from a student is, how has the COVID-19 pandemic affected your experiences with healthcare innovation? Have you seen or become aware of the problem you are trying to address with innovation get worse in rural areas as a result of the pandemic? And has that further shaped your vision?
Yeah, So we thought of this product in fall of 2019, when the pandemic wasn't even, it was some little bird flu in China is all we knew about it. It was nothing to be alarmed of. And so we saw this problem pre-pandemic, and working in healthcare facilities now, and seeing COVID-19 firsthand and how it has affected communities and rural communities at that, and how this product can not alleviate the issue, but help, suppress it a little bit. It's kind of like helped, further drive us more to get this through as quickly as possible. We may make a little bit of money out of this, but the end goal is just to really make a difference on future patients' lives that we will probably never see. But just knowing that one day that we could have an impact on so many people is kind of what keeps us going. But that's kind of what the pandemic has definitely, I guess, pushed us to go further. But I was trying to read what was the rest of the question. But yeah, having that impact on rural communities, we believe our product definitely will help with that. And we've been fortunate through the whole discovery of our company And all of our innovation entrepreneurship competitions, they've all been through the pandemic and virtually. So we've just become really good at doing virtual pitch competitions. We've kind of mastered them all by now, we like to say. So I don't know if that's worked in our favor or not, that we've only had to do them online and haven't had to go to Nashville or Memphis or wherever to these other places. But the pandemic has helped our business grow, I think, because we've been able to focus more time on it as well.
Yeah, I mean, what he said, I guess I don't really have anything to piggyback off that.
Oh yeah. Well, I guess to kind of further it, because I know the COVID-19 pandemic has really affected us all. I know, especially here in academia. I know, Libby, you graduated in the midst of it all. So how has it kind of affected y'all's lives as, not, let's get away from the entrepreneur side, but as students, kind of. Since I know, Daniel, you'll be graduating this semester. Libby, you're going to be entering PT school in the fall. Like, how has this kind of affected your journeys as students today?
Yeah, so it was definitely interesting having to hold your breath, hoping that you're getting a graduation ceremony. That was kind of the first thing that how COVID really affected me, other than my very last semester at school being taken away from me. So I didn't get to say all those goodbyes, I guess, at Tech that I would have normally said. But it was really interesting because applying to PA school, if anyone is interested in becoming a physician assistant, you know that the application is long and hard. The interviews are long and hard. And so in light of COVID-19, some of these were virtual, some of them were in person. Trying to interview when you're so nervous and there's a panel of people around you and you have a mask on and you're already kind of hot because you're nervous. So that part was definitely challenging for me. And then the other side of that is a virtual interview. While you think that might be easier, I am a talker. I'm a people person. I talk a lot with my hands. So I couldn't gauge the audience, so to say, or the interviewers when I was just sitting behind a computer screen at my house. So it kind of made it a little bit harder, I would say, in the interview process for PA school. And then I have no idea what my graduate program will look like when I start in August. It'll be very different, I'm sure, than what I could have imagined it being. So it's definitely affected us personally, I would say.
And Libby was able to get married through this past October.
Yeah, I had
Let's
a
talk
wedding
about that.
in COVID.
Can't forget
Okay,
that.
so
she made
that's
it
impossible.
through.
Don't recommend it. If there's ever another pandemic, I recommend you just waiting to get married or just go to the courthouse.
Yeah, personally, it was obviously looking back to a year ago today, just seeing some of my memories come up, like how, we were just living in unknown time, just at home. I moved back home with my family and was doing Zoom calls for my education, which was, interesting. But I've been fortunate enough since I've been back on campus that I haven't had any classes that I've met strictly virtually, that I've had to Zoom in at certain times. I've been fortunate that I got a job on campus. I'm on campus a lot. I see other students on campus. And I'm able to attend some of my classes in person on campus. And I know the university is starting to get more and more towards back to an on-campus model as we were pre-pandemic. But also, too, it's been really nice. It's kind of been convenient to have a virtual option for days when, if I've got to, go back to Nashville to work at the hospital, but I've got a Zoom class Friday morning, I've got to have a meeting Friday morning, I can attend virtually, which has been, I don't know why we haven't been doing this forever. You wake up for your 8 a.m. at 7:55, you just have to roll over and flip on your computer and you're in class. So, it's been challenging, but I think it's also alleviated some of the issues of, being stressed to try to get to class on time, or, having to run all over campus to meet with a professor or attend meetings when you can sit in one place and get it all done. So I think the university has definitely supported the students the best way it can through the midst of all this. But yeah, I'd say we've been pretty fortunate to manage these weird times.
Oh yes, and we're very. I know Tech's very glad to have you both as some of its shining stars. So, and thank you both for your amazing service to this university. So I'm trying to. So I guess for anyone on this call, what would you say are some things that, like, how can students get involved in rural healthcare or entrepreneurship? Like, because I know we've talked about today a lot about finding those opportunities. So, and that's our job in Rural Reimagined, to connect students with opportunities, whether if they're a music major, how or art or communications. So what would you say are those ways to get involved?
Yeah, I would say that no matter what course of study you're in, anyone is able to volunteer at the RAM clinic. Not a lot of people know that the university, it's actually one of the only student-led RAM clinics in the country. There's thousands across the country every year, all year. And if you don't know what the RAM clinic is, it is a 2, sometimes 3-day event that Tech students put on by the RAM Club at Tech, where we have physicians, dentists, optometrists, nurses, dental hygienists, all kinds of healthcare practitioners come and volunteer their time and provide free healthcare to those that are in Cookeville, because I didn't realize it, and I'm sure a lot of people on here don't either, that Tech is actually very underserved. We have quite a few people in the community, quite a few Hispanic people in the community that come to the RAM clinic, which is, I'm sure, why Dr. Geist was so passionate about writing that grant. But anybody can volunteer. You can hand out water bottles. You can, if you are a medical student, you can get your bloodborne pathogen certificate. The university can help you with that. And you can, take patients from place to place. You can take temperatures. If you're a nursing student, you could take blood pressures and do that type of thing exam wise. But anybody, if you're wanting to volunteer in rural healthcare, so to say, anybody can volunteer at the RAM clinic. You do not just have to be a healthcare student, because they would love all the help that they can get, I'm quite sure.
Oh yeah, that's definitely the best way to not only just get involved in some rural help throughout the area, but it's really just the best way to see the need that exists in such a metropolis like Cookeville is. Cookeville's big to so many people and so great, but you go just 15-20 minutes beyond Cookeville and you're in some pretty hard hit areas that lack proper access to healthcare, or people who can't afford healthcare. So having this remote area medical clinic that's offered every year really makes an impact on these patients' lives, because that's sometimes the only time they ever get to see a dentist, the only time they get to see a physician or a nurse. And I know we're thankful that this one, I think they even offered the COVID vaccine, which was super cool, because some of these places, live so far away from places that are offering the vaccine. So I think that the fact that it's student led just absolutely, it really blows your mind when you actually participate in it and see the extent to what it takes for somebody to pull it off. It's really amazing, and just shows the quality of student that we have at Tennessee Tech that can lead something like that.
Oh yes, so certainly, definitely. We actually, I know RAM really works heavily with Rural Reimagined. Many of its students are part of the club and really work heavily with the club itself. So we're very glad to have Rural Reimagined part of have Rural Reimagined working with RAM and doing some amazing things. And I know they did it, I think, spring break. Is that right? So yeah.
Yeah, it's as long as I was at Tech, it was the Friday and Saturday of spring break, whether it was the beginning of spring break or the end of spring break. And so it's very rewarding to be able to participate in that, if you're a student, like I said, of any discipline.
I guess. So I guess I know, Daniel, because you have a lab to run off to soon. So I guess my final question for you all is, what are some key takeaways that students who are watching this call, who are either passionate about healthcare, passionate about entrepreneurship, or just don't know where to even begin? They're just they just come to Tech and they just don't know what they want to do, with their lives or with their degree. What are just some takeaways that you want our students to take away from the talk? So Yes.
I'd say, there's so many ways to go with this, but, just get involved on campus in whatever way you can. If you're interested in healthcare and innovation, getting like your CNA license or scribing at a local facility around Cookeville, being a phlebotomist, that makes you eligible to take that clinical immersions course. Sorry, to take that clinical immersions course, and that kind of just like helps foster innovation and foster idea. And if you do have an idea, talk to the Biz Foundry, talk to the Center for Innovation and Entrepreneurship, here at Tech, compete in EagleWorks. And also, as we both hit on, is, find people that are in your corner, find a good professor. There's so many professors involved in research that, they're also trying to do similar things, but with ideas, in a sense, I guess you could say. So, find people who are in your corner that can support you. There's so many resources here in Cookeville. You don't have to go all the way to Nashville to find good legal help and find good, innovation help. There's so many places around here that can help with that, and get connected with them.
And I would say if you already have an idea that you're passionate about, but you like Daniel said, the drawing on the back of a cocktail napkin, that's some lingo that we've learned through this business world that we've been in. So that would be if you just have an idea, but you don't really know where to go from here. You might have a prototype that you made in your garage or something like that. The Biz Foundry, I know we have said the Biz Foundry a lot. There are multiple Biz Foundries all across the state of Tennessee. As you said, Governor Lee is very passionate about initiating entrepreneurship and innovation. And so the Biz Foundry, the one in Cookeville, Jeff Brown is over. And I know there is one in Nashville, and they were even talking about opening up one in Dixon, and there's one in Memphis. And so at these places, you can just walk in and automatically be connected to a business consultant, an accountant, graphic designers, engineers that are there trying to, help design things. And so I think just realizing that the opportunity is there and people definitely want to help you. You just have to know where to look. So the Biz Foundry, the Small Business Development Center has lots of government funding, like Daniel was saying, especially from the CARES Act with COVID relief. The Small Business Development Center and the Biz Foundry are going to be the two next best places for you after you've already gone to people like Michael Aiken or what is the other guy's name that does EagleWorks? Is there someone that helps him with EagleWorks maybe?
Is it
Dr.
Andrea?
Yes, well, Andrea, yeah, the lady who works with him, she's great also, but I thought maybe there was another professor. But after you've already explored your on-campus resources, then just know that there are other off-campus resources for you as well. And once you just walk into the Biz Foundry, I mean, the doors are open all the time, and Jeff Brown loves to talk. So you can just walk in, and there are so many people that want to help you succeed. You just have to find them.
I know, and the Biz Foundry is just a stone's throw from the university as well. It's just right there, almost right around the corner from Cream City. So you could walk over there if you needed to.
Oh yes, for sure. And I know TCRI, they hire student interns all the time. So for graphic designers and accounting majors and business majors. So there's definitely a need, even if you don't want to start a company or a business, you can still help serve other, local rural businesses as well.
Absolutely.
Yes. Well, thank you, Libby and Daniel, for just coming on this talk. I know this was certainly an amazing talk, and I know I definitely learned a lot about just rural healthcare and innovations, a field that I know I'm not. I'm an engineering major. That's not my. That's not my wheelhouse, but it was very great to have you here and to bring light onto just your rural journeys. And I really do hope that whoever's on this call and whoever will be watching later can draw great inspiration from both of y'all.
Yes, thank you so much for having us. We're happy to be here. And if anyone ever wants to reach out to Daniel and I, we're an open book with our journey. We're happy to help connect you with people because that's how we've gotten as far as we have. People have connected us. Life is about connections. So we're happy to steer you in the right direction. If anyone needs help, I'm happy for Kester to share either of our emails.
Oh, yes,
absolutely. Yeah. And thank you, Kester, yeah, for inviting us. As Libby said, we're super glad to share our journey, and we are very open. So please reach out. We love helping people and letting people know how we got to where we've been and where we're at today.
Yes, and that's definitely the mission of Rural Reimagined. That's definitely what I do, is just connect people. So we're very glad to hopefully see what connections can form with the two of y'all. So thank you both again, and thank you to all our audience who are watching today. As a quick announcement, our last club meeting for the semester will be virtual on April 13th. And we're hoping that that'll be Tuesday, and it will be held on Zoom at 11 a.m. And hopefully we'll have our final Rural Journey speaker series the following Tuesday, April 20th at 11 a.m. on which you can log in on the TAB website. And so we'll have this video uploaded for anyone who wasn't able to be on the call today. And so please do follow us online at TN Tech Rural Reimagine or at TN Tech RRC on Facebook and Instagram for more Rural Reimagine updates. So I think that's everything I could think of. So thank you again for everyone watching, and thanks again to Daniel and Libby for coming on. And we all hope that you have a great day and continue to be inspired to go out and serve, rural areas.
Thank you very much.
Thanks, guys.